I always question whether postnatal mood disorders are the consequence of busy and lonely modern lives. If this is not the case, how did people approach postnatal mood changes in the past and in different cultures?
Well, we think that severe mood disorders and severe perinatal mood disorders can be traced back in history and into ancient literature, and it's likely that these are problems that have been affecting women since women started having babies.
The first potential reference to childbirth-related depression can be found in the book of Genesis. With pain thou shalt bear children. As the original Hebrew word translated into pain also means sorrow or sadness.
Well, there is a big question in history of medicine and history of psychiatry in general, which is the question of how we can access, reconstruct the subjectivity of patients, and in particular the voice of this category of patients, like children, like women, and other categories like disabled people to some extent, categories of individuals who were not really given a voice or were not really centered by the main narrative, which was, of course, one of power or empowerment. So basically, when we talk about gynecology, the point of view which is centered is always the point of view of the male doctor, the husband, the father, and so on. So the question of perinatal mood disorders, of course, forces us to try and interpret and somehow read between the lines of this kind of very centered narrative that we have. For example, one of the greatest doctors of antiquity, Serenus, a gynecological author from the 2nd century, speaks about lupe, grief, pain, sadness in case of women, and sees this as a problem, a medical problem, but always in a pragmatical kind of utilitaristic interpretation. If we allow ourselves to also look at mythological literary texts, and I really think we should when we are posing this kind of, in the end, cultural, historical questions, then you can find indeed traces of perinatal mood disturbance also in texts, for example, of the 5th century BC. If we look at tragedy, which is a genre in Greek literature, which is especially concerned with paradoxically, from the outside, with the fate of women and with the psychology of women as well, you can find many representations of problematic motherhood, to put it mildly, so to say. And of course, if you look at these in a literal way, what you have is very paradoxical figures of strong, empowered women who reject or somehow have a violent relationship with their own offspring. And I can give you a few examples of this. For example, Medea. This is a very famous case of a woman who, of course, for a complex network of social reasons which are not interesting for us now, but who end up killing her own children. And she's not, her children are grown up, but from the point of view of representation, I think in this kind of portrayal of violence, always nesting within the experience of motherhood, of maternity, you can find a hint of this problematic psychological suffering. It's interesting to remember that Medea, in one particular case, compares the fate of women to the fate of men in society or in life in general, and she says very specifically that there are men who always boast that their life is more difficult than the life of women because they have to go to war. And she says, how foolish to think that. I would rather go to war 3 times than give birth once. And of course, Medea is always represented as a monstrous figure, the paradoxical, kind of corruption of all the natural instincts that a mother should have. But I think if you look at the story from a different angle, you can see many subtlety in the psychology of her situations that actually correspond very well to what the social experience of being a mother in a patriarchal society must be like. And you have, again, the frequency of this kind of figures in tragedy is quite striking. For instance, there is a scene in a play by Aeschylus, The Libation Bearers, where Clytemnestra, who is another great, strong figure of empowered woman, she decided to kill her husband because of what he had done to her and to her own daughter. So she's a protective, successful, strong woman. She has a dream, and in this dream, she has given birth to her child Orestes, but this child is not a human child, but a snake. And in this dream, she's cuddling this snake, and what the baby snake is suckling is not milk, but milk mixed with blood clot. And of course, this is mythologically and dramatically a hint to the fact that Orestes will then kill her to punish her. But the point is, in this kind of imagery, there is a tension, and there is always a kind of mixture of maternity and violence that I think is very important for us to understand. How is it possible that certain subjective points of view are completely erased from a society? Of course, this is not the case. It's just that they come out in a different metaphorical, allegorical form.
In medieval times, an extraordinary woman wrote the first known English autobiography named The Book of Margery Camp. She was a Christian mystic lived in 15th century. Her first pregnancy was rocky. She experienced a very difficult delivery. With her own words, she despaired of her life, thinking that she might not live. So she called for a priest to confess. The fear of damnation by the priest became the last trigger for what had been waiting for her. She wrote, "She went out of her mind and was amazingly disturbed and tormented with the spirits for half a year, 8 weeks and odd days." Another way of saying around 8 months. One day she saw the vision of Christ by her bed. He ordered her not to forsake him. She took it as a sign of recovery. The reality is, she gave birth to 13 more children and kept on seeing visions of Christ, God, and spirits. We learn from Margery Camp that two things have not changed from 15th century to now. First one is the feelings of a mother who experienced postnatal mood disorders. Secondly, both in 15th and 21st century, it is unusual to openly talk about the feelings and experiences of a woman if they are considered to be extreme by the rest of the society.